Laboratory setup. Phase 3, preparing the tray. Indicate the trim line on the model. Carefully trim the tray material. Avoid bracket hooks with the burr. You can easily separate the setup trays from the model using a laboratory knife. You have now created a setup tray with brackets positioned where you want them. Note the cured adhesive on each bracket has formed a tooth-specific custom resin base. The tray should now be fully exposed to the light chamber for 1 minute, or an Ortholux XT curing light for 5 seconds per bracket to completely cure the custom resin base. Separate the soft inner tray from the hard outer tray. This will make tray removal easier during the bonding. Smooth the hard edges for patient comfort. An acrylic burr may be useful. Trim the edges of the soft tray, especially around hooks, to facilitate tray removal. In Dr. Sandi's office, the assistants prefer to trim the soft trays individually. However, this can be done by the laboratory technician. Or the two trays can be trimmed together. If there are no hooks, trimming is optional. Cut the soft inner tray at its midline to make removal easier in the patient's mouth. Replace the soft inner tray into the hard outer tray. Place the transfer trays in the ultrasonic beaker with 10:1 ratio of water to dishwashing detergent. Remove the trays after cleaning. Rinse the trays with tap water. Trays are placed back in the ultrasonic for final cleaning in distilled water only. Remove from the beaker. Air dry the tray. Micro etch the dry custom resin base to roughen it. Do not abrade the resin. 50 micron aluminum oxide is used. Do not use 90 micron as it will abrade the custom resin base. Apply acetone to the micro-etched base to clean it and let it air dry. Operatory. Indirect tray insertion. Full arch using two-handed technique. Preparing the teeth. This is a typical tray setup for an indirect bonding procedure. Care must be taken to prevent the Sandi Rapid Set Resin A from touching Resin B. Keep the wells and brushes separate. Bottle caps and brush holders are now color-coded to avoid cross-contamination. Follow your normal tooth preparation procedure. The teeth must be cleaned, isolated, and etched. Apply Transbond gel etch to the lower arch. Time according to the manufacturer's directions. Application of Sandi Rapid Set Indirect Resin. Paint a thin layer of Resin A onto the teeth. Applying this thin layer is similar to painting one's nails. Note how the thin layer of Resin A is applied to the tooth surface. Note how the thin layer of Resin B is applied to the custom resin base. Seat the lower tray with a hinge motion. Note the firm pressure occlusally, labially, and buccally to avoid tray rotation. Hold the segment firmly for a minimum of 30 seconds using a timer. The tray must sit for a minimum of 2 minutes prior to removal. Repeat the preparation and isolation for upper arch using the same technique. Paint a thin layer of Resin A on the upper teeth. Paint a thin layer of Resin B on custom resin bases using a different brush. Note that the resin working time is not an issue until resin A and resin B finally come into contact. Seat the upper tray with a hinge motion. Note the firm pressure occlusally, labially, and buccally to avoid tray rotation. Hold the tray firmly for a minimum of 30 seconds using a timer. After the 30-second hold time, let the tray sit for 2 minutes.